So how the reading part B is designed. We are gonna learn today the reading part B section. Okay. Now part B of reading has 6 short paragraphs. Which are these paragraphs related to? Does anyone know? What kind of paragraphs do I get in reading part B? It's true that they are all workplace related, but can you give me some examples? They are all always workplace related, which means they are the kind of uh, paragraphs that I would be reading rather when I'm working, okay, or um, when the administration is trying to discuss things with me. So I couldn't understand what do you mean by conversation, because conversation is mainly when you have uh, listening, isn't it? Here you don't have a conversation, but it is a communication. It is workplace communication. So usually in your workplace, what kind of communication have you witnessed? Yes, it could be memo. Okay. What do you mean by a memo? Any idea? When do we receive memo, or when do we need to send a memo? When it would be used? It's used as a reminder, it's used as a warning, and it's used at times to re-emphasize previous guidelines, or to re-emphasize the previous protocol. Okay, then what else? Apart from memo, you can have notice. Okay, what are these notices for? So notice is for informing. Memo is for reminder. Notice can be for providing information. Now, to inform, it could be to inform about a new protocol. It could be to inform about a new way of treating disease. For example, it could be a new medication that the hospital has started using. What else? Apart from memo and notice, what other kinds of documents can you be reading, or the extracts from the documents that you would be reading in the reading part B? It could be policy. Yes. So if it is a policy document, give me a moment, please. When do we use a policy document, or when an administration would send an extract from a policy document? Yeah, the policy document would, yes, it would be related to a particular procedure. For example, how to administer IV, IV insulin, or it could be related to a particular treatment or investigations or safety protocols, or it could be related to infection control. So the policy document usually will be sent for 2 reasons. One is if they have introduced a new policy, or if they have updated a recent policy, right? So it could be both. It could be either a new policy. See why these things are very, very important. I'll help you understand in a short while why it's important to identify first what kind of document are you using, and what would be the usual purpose of that kind of document. Okay? So it could be a new policy, or it can be an update to the existing policy. Then you can have email. So all of us are familiar about the emails, right? So emails will be about notification. It could be a notification related to an event that is happening in the hospital. It could be a notification related to upgradation of your current registration. It could be a notification related to completing the registration procedure or reviewing something. It could be a new course that maybe is going to begin in your hospital, and then the administration wants you to attend that course. It could be a CME that is taking place. So email is mainly about the notification. Then you can have a guideline. Guideline also can be in both the ways. It could be either a new guideline or it could be for an update to the existing guidelines. Now, if you understand the purposes of each kind of documents, it becomes really, really easy for you to know what to focus upon whenever you are reading a particular kind of document. Okay. And then finally, you can have manual. I'm sure all of you know what the manuals are all about. When do we use manuals, or what can be the manuals all about? What kind of information can they include? I'm sure all of you have used manual. So what are they used for? Where have you last instructions on how to use? Yeah, in fact, it could be instruction probably on how to install, okay, then how to use or what care is to be taken. It can also include details about how to disinfect it or how to clean it. It could also have information about troubleshooting. Yes, so you should have a very, very clear idea about the each kind of document can you have, in the reading part B test. Because if you have this clarity on the type of document that you are reading, you can, get a very clear focus. You can understand what exactly should you read for. Okay. Now, for each of this paragraph that you will have, you would have one question for each paragraph. That means a total of 6 questions will be there. And the length of each paragraph is going to be around 150 to 160 words maximum. Okay. And how much time do you get for reading part B? I would say ideally you should be able to complete this 6 questions in exactly 10 minutes time, which means you get less than 2 minutes time for each question that you are dealing with. Now, what is the strategy that you use for reading part B questions? How do you approach these kind of questions? Okay, is the first thing you do is the first step is read the question. You read the question to identify the focus, which means what I have to do. Whenever you are reading the question, ask yourself what I have to do in this question. Okay, so there can be 3 possible answers to what you have to do in any of the reading part B questions. Okay, you could be the one possibility is that you could be reading for gist, or what is popularly known as main idea. Okay, the second reason or the second thing that you may have to do while you are looking at a reading part B question could be reading for purpose. Okay, and third thing can be reading for detail. So you should have the ability to understand, just like we discussed the types of documents. Similarly, you should have the ability to understand whether the type of question you are dealing with is what kind of question. Is it asking you to read for detail? Is it asking you to read for purpose? Is it asking you to read for main idea? So the strategy of main idea and purpose is quite similar, but the strategy of reading for detail is slightly different than the other two types. Okay, now the focus of today's session is going to be on reading for detail. Okay, so I'm mainly going to discuss the strategies for reading for details in this particular session, and we are also going to do some practice tasks to help you get hands-on experience on how to handle reading for detail questions. The strategy for reading for main idea and reading for purpose is slightly different. We did it in the last session, so I'm not repeating that here. And let us straight away go to the test and let us do the reading for detail questions. Right? It's very, very important that you are able to differentiate the type of question, because you would need a separate strategy for each question type. Just like you can't give you know you can't give an IV insulin with the help of drinking water, and at the same time you can't give tablet paracetamol with the help of a syringe and a needle. So you would have to use appropriate strategy, and for that you would need to understand the type of question that you are dealing with. Okay, so the first thing, as I said, we would do is we would read, what do I have to do? So here it says, according to the update, that means this is an update. Allergens do not need to be written on packaging if, which means I have to read this particular document to find out one detail. What is that detail? When not to write, or when do we don't need to write the name of allergens on the packaging. And this is an update. That means there is some change in the existing criteria. Now, this is my first step. Uh, Another hint that I could give you about identifying the detail question is the question prompt of main idea or the question prompt of purpose question will be very vague. The main idea question would say, this update informs us that, this email informs us that, this guideline describes the changes in, for example, but it doesn't actually say what the guidelines are all about or exactly what I have to read. But in detail question, the question prompt itself will ask you to find out a specific situation. Okay, sometimes it may ask you to find out a condition, sometimes it may ask you to find out an exception. So here it is a condition. It's saying what is the condition that must be fulfilled for us in order to not to mention the allergens on the packaging, right? So I'm sure all of you understand the term allergen, the chemicals that can cause allergic reaction. And here it says improved labeling for allergens. So this definitely would include the different types of medications, okay, and if they include any allergen in it. Now, next step, what I would do is after reading the question, step 2 for me is straight away go to the paragraph. Do not read answer choices at this stage because they may confuse you. Okay, so do not read answer choices before reading the paragraph. After reading question, straight away go to the paragraph, and now you have a focus in your mind. It says, when do I not need to write the allergens? So what I would do is basically I would skim through the paragraph very quickly. I would read very quickly until I get the details about when not to write about the allergens. So here you can say that there have been some changes. These ingredients were initially not included, but now they have also been included in the list of allergens, or they have also been included in the list of allergens that must be mentioned on the packaging. Now, what I have to find out is when not to mention. So here it says in some circumstances, allergens do not need to be declared on the medicine label. So in some circumstances, that means there are certain exceptions. So what are those exceptions? Now here it's example. Okay, an example says some substances may only cause a reaction if they are administered orally. Therefore, don't have to be declared if the medicine is only for topical use. Now here I have something about taking orally. It says the medicine is intended to be taken by mouth. Now see, this is the reason why having a clear focus is very, very important. What we were looking for is when not to mention. Here it says that they are not to be mentioned if the medication is to be applied topically, whereas A says if the medication is to be taken by mouth. So then this is wrong. And some substances are only declared if there is a certain amount. Okay? This kind of words can easily distract you. Certain amount. What do you mean by certain amount? And they are only declared if there is a certain amount. So again, it doesn't tell us about when not to declare. What we are looking for is when not to declare. And again, it doesn't give us any specific thing whether they are in low amount or in high amount. But if you look at here, it says a small amount of allergen in the medicine. So this is quite tricky, option C, because you would, if you think a lot about it, you would think that, okay, if, 1 gram is there, it would cause allergic reaction. So if it is less than 1 gram, it wouldn't cause. So maybe this is correct answer. But the paragraph doesn't tell you anything about the higher or the lower quantity. It just tells you certain amount. Okay, and then we'll have to also remember the fact that these are examples. Okay, these are examples. That means I have to choose an answer option that combines both of the examples. So what I can understand from both these examples is that if the medication is likely to cause reaction if it is taken orally, but if I'm giving a topical medication, in that it would not be required, which means if it is topical medication, it will not cause reaction. It will cause reaction only if it is taken orally. Similarly, certain medications will cause allergic reaction only if there is a certain amount. So that means if my product does not have that certain amount, then probably I would not need. So B is the correct answer here because it covers both the examples. If the medicine administration is unlikely to result in a reaction. So even in a detailed type of question, still the answer option will be inferential. Okay. So detail does not mean part A like question where you exactly find out a word from the text and then you write it as it is. No. But here you don't need to cover the summary of the whole paragraph, but you are looking for a specific piece of information. So let me very quickly review the strategy for detailed questions. Strategy 1, I read the question, try and find out exactly what I have to read for. So here we decided that we have to read for the situations when allergens should not be mentioned. 2, I don't read answer choices first, I read the paragraph first so that I understand what the paragraph is all about. And even when I read the paragraph, I do not read every single line very carefully. I only try to read a specific portion carefully. That is only for detailed question, remember. Okay. So I only read a specific portion carefully. So we only analyzed the portion which talked about when not to mention the allergens. And then both of them happened to be examples. Okay. And both the examples were kind of contradicting what is given in the paragraph. So that is how we ruled out the other two answer choices. Okay, so third step for us is once we have understood the detail, then we go and match it with the answer choices. Now here this is slightly different. In main idea questions, I usually recommend that you should not go to and fro. You should just once read the paragraph and then answer. But if it is a detailed question, you may need to read the paragraph one more time just to make sure that the answer choice that you have selected is, correctly representing what is given in the paragraph. So in detailed question, you may need to do this, but detailed questions are comparatively very easy. So if your short-term memory is good, you may not even need to read it for the second time. If you kind of, because it is just 120, 130 or maximum 150 words. So you won't actually need to read it all over again. If your short-term memory is good, you will be able to remember, what it is trying to say. So this is how a strategy of reading part B, detail question is. Let us do one more question together, and then I'm going to ask rest of the four questions I'm going to ask all of you to do. Okay, so let us move to question number 2. Okay, it says the email explains that ongoing professional development must be demonstrated. So must be demonstrated is my keyword. It means this is something which isn't optional. What is compulsory while uh, submitting, or while you are looking at your ongoing professional development, or when you are trying to prove or demonstrate ongoing professional development. Again, I would read the paragraph first. It is mainly for all the nursing staff. It is related to professional development. And I would look mainly for expressions which would say it is compulsory. If they are talking about the things which is the only alternative for them to submit it. And then I would kind of compare the paragraph with the answer choices. So here they have mentioned that it can be done by filling a record sheet of activities for the year. So you need to fill a record sheet. They have given the attached template can be used. Can be used is optional. Must be demonstrated is compulsory. Alternatively, you can devise your own. Okay. So either you can use the template that is given, or you can use or develop your own template. Here devise means to develop or to create. Now let us compare this with answer choice. It says that here it says completing the form attached to the email. So this is kind of correct, but it is not must. Okay? You can either use the template that is attached to the email, or you can use your own template. It is not compulsory. Then, while you do not need to submit evidence of your CPD board annually, you don't need to submit annually. Whereas here it says on a yearly basis. Okay? So this is how in detail question it may happen that you would simultaneously read the paragraph, go to and fro, and simultaneously you will be ruling out the other answer choices as well. But it is mentioned that you need to prove to the board that you are kind of undertaking the activities related to your professional development, and you are keeping yourself updated. So here it is given that the staff must keep the evidence of CPD attendance. So you must have evidence to prove that you have attended. Now these are all the options which you can do. And for 3 years in case of an audit. So you need to keep those documents with you for the next 3 years. And it could be the audit is in fact conducted each year. So submission is not done each year, but the audit is done each year. So can I say here B is the correct answer? Yes, because it says that they should record the details. They must fill in a record sheet of their activities for that particular year, and they will also need to preserve the evidences. So see, this option kind of does not actually summarize the whole paragraph, right? It is reading for a specific detail. So these type of questions are comparatively easy, but the number of questions that you get in reading part B, the detailed questions will be hardly one question. Majority of the questions that you will have in the reading part B will be either reading for gist or reading for purpose. So when you are practicing for reading part B, you should focus more on those two types of questions. But it's also very important that you're familiar that there can be a detailed question as well. Otherwise, in this kind of questions, if you will try to find out a summary of it may not be possible for you to summarize the whole paragraph, because the paragraph may give two, three separate ideas, okay, and they will not probably be all, and the answer choice may not actually, none of the answer choices may be summarizing it, because basically the question is a detail type of question. So in detail type of question, you should have a clear focus in your mind exactly what you are reading for. Whereas in reading other questions, the main idea or purpose questions, you'll be keeping the gist in mind. You'll just very quickly read it. You will read it to get an overview, okay, from it, and you will try and identify why the document is written. Okay, so now let us do this practice tasks where we are going to do four more questions. They are the same type of questions that we did so far. Okay, so what I'm going to do basically is I'm going to get the question on screen, and then I want all of you to apply the strategy that you have learned, and then summarize, finalize your answer, and then type the answer in the chat box. Okay, and send in your answers privately so that the other students are not getting it. Okay, and I would be giving all of you 3 minutes time for first two questions and then 2 minutes time. Go ahead. You have 3 minutes. Read the question first. Identify the focus of the question. Then read the text very quickly to identify exactly which portion of the text gives you the required information. Then read that portion in detail. Then kind of compare that portion with the answer choices and finalize your answer. So it says city is preferred to MRI, right? It means the question is particularly asking us, when is CT scan preferred as compared to MRI? So the word MRI when may distract you. You're not reading to identify when an MRI is done. You are trying to find out when a CT scan is done. CT scan is preferred to MRI. When I say I prefer tea over coffee, means I prefer tea more than the coffee. As soon as you are done, just type in your answers in the chat box. So the first statement here talks about both MRI and CT scan. Then the second statement is more about MRI is the preferred procedure. Third is also about MRI. And then the next sentence says it should be ordered. Now, whenever it or this is used, it is always representing the idea that is mentioned in the previous paragraph. That means this it should be ordered is also for MRI. Okay, so MRI is ordered when the clinical history and um, eyewitness description is there, and if when you also have electroencephalogram that does not show generalized epileptic discharges, which means if it is not generalized, it is localized. So here you do have an option which says a localized seizure source, but that's about MRI. See, this is how the questions are formed in a very tricky way. See, these are all standard exams. They are Cambridge exams. Okay? So they are very, very different from the exams that you may have taken so far. So the level of English here or the kind of questions you have will not be that easy. So it's very, very important that you understand the question very clearly in haphazard manner. If you do it, if you do it in hurry, you may not understand the focus of the question. So if you misunderstand this, that they are asking when MRI is done, you may end up choosing wrong answer. So here option C can be ruled out because it is to be done when there is a localized seizure, that is MRI. Then here also it says it is a high resonance um, magnetic resonance imaging. The MRI in fact have a higher resolution. So that is also ruled out. Okay. And here it says that CT should be performed if there is intracranial bleeding because of recent head trauma or coagulopathy or severe headache. So recent tells you urgent diagnosis is required. Okay, so with both the methods, one is to rule out the wrong answer choices. By ruling out also you can get this answer. That other two options mainly talk about MRI, whereas the question is asking when would we prefer CT scan as compared to MRI. So I can see all of you who have sent the answers here have selected A. That's very good. Now, you'll just have to ensure that if you are doing it in slightly less time, still you are able to get the correct focus. So now let us do fourth question. Again, I'm going to give you 3 minutes time. Read the question first, identify the focus of the question, then straight away go to the paragraph, identify the portion of the paragraph that talks about that specific detail, and then kind of compare that detail with the answer choices. And then type in your answers in the chat box. So from here, this point onwards, they have started talking about long break. Okay, so rest of all the details are about long break, but the focus of this question is short break and what the nurse must do. So in the short break, it is only given that they must give a short verbal handover, right? A verbal handover, not a written one. So rest of both the options talk about written documentation or record, and therefore they can be ruled out, right? And A is the correct answer. Again, this time all of you got it correct. That's excellent. So now what we are going to do is we are going to make this time limit to 2 minutes. Okay, and let's see how you all are doing. And as I said, when you will be doing it actually in the exam, you may be even taking less than 2 minutes, because in 10 minutes time you need to complete the 12 questions. And it would be good if you take less time for detailed questions, because you know that the rest of the questions consume more time, the main idea or purpose questions. Okay, so you have a next question here. And this time I'll discuss both of them together. So after 2 minutes, I'll bring the next question on screen, and then I'll discuss both of them together. Next question. Okay, so that's, you can start typing in your answer if you have completed that. This time, please type in with question number so that would be less confusing for me. I'm waiting for everyone's answer to come and then I would start discussing. So for fifth one, a lot of you have chosen A and one or two of you have chosen C. Yeah, so let's see. I would re-emphasize the importance of identifying the focus of the question. It says what the GPs should do, isn't it? GPs with patients attending it as outpatients should. So that means this is particularly C, a memo to all the local GPs. So this is written mainly for GPs and it is saying what the GPs should do. Now they have informed here that this service that they are starting with the email notification is optional, right? So that clearly helps me rule out B here. No longer be posted. No longer is an extreme word. Okay? Always look for extreme words, negative words, and blanket words when you're looking at the answer choices because these words can completely change the meaning of the entire sentence. So no longer be posted means now the only option is email, whereas the paragraph doesn't say that the only option is email. It is both the options are still available. Now it's what is it saying is that if you read it carefully, it says that the service provides fast delivery of information, additional information, and all emails are password protected. They will be asked to provide their name, date of birth. It says patients can sign up through the hospital website. So the GPs don't have to create the profile or GPs don't have to actually create this. It says, please mention to patients that. So what GPs have to do is they have to provide them information. Yes, ensure that the patients are aware of the new arrangements. GPs don't have to provide the access to the new service because it is saying straight away that the patient can sign up through the hospital website. They will be asked to provide these details. What the GPs have to do is please mention to patients that this service is now available when you are making referrals. So it is not under GP's scope of practice to give access. GPs just have to inform or make them aware. So C is the correct answer here, not A. Right? So identifying the focus of the question is very, very important. And for sixth one, let us discuss sixth one now. So for sixth one, I can see A, C, and some of you have selected B. So basically we have all three options here, A, B, and C. Okay. Now see, again, the focus is before the day of the procedure, patients should, what the patients have to do. Now, when you talk about the tests, okay, so the tests are to be done by the healthcare professional. It is something that it's given that any pre-procedure investigation, okay, should ideally be scheduled at booking to aid patient preparation on the day of the procedure. And this is written for whom? This is for all the staff, because it is saying patient selection, pre-assessment and preparation. So who is going to do patient selection? The staff. Who is going to do the pre-assessment? The staff. But what they have to do, the question is asking what they have to do before the day of the procedure. But if this is a sentence completion task, basically it says patients should. So if I select this and if I read it fully, it may mean that the patients should arrange. And that is why it is wrong. It is the healthcare professional who need to arrange. Then nothing is given about the carer as such. It just says that um, if the patients do not have the capacity, the main thing you need to do here is that they, if the patients lack the capacity of the understanding the implication of it, then a meeting of best interest may also need to be facilitated. When the patient has no next of kin available, the input of an independent advocate may be required. But it's not about accompanying them, isn't it? It's more about explaining the procedure and its implications. So C can be ruled out in that way. You may need to identify a carer, particular, and then again there is a condition. Identifying carer only if the patient himself is not able to understand. Always be very, very vigilant about the exceptions and ifs and buts. Okay. All this reading part B text will always have a lot of ifs and buts. Like we were having allergens, it did say a lot of ifs and buts. If this is there, then you should do this. If this is, and you always know that the guidelines and protocols are always like this. They always give us two, three options depending on the patient's requirement. So here also you have if. It says that where patients lack the capacity to understand the implications. So if the patient himself is not able to understand, then you will have to find out someone, a next of kin. If next of kin is not available, then you may identify an independent advocate. But why? For explaining the implications, not to accompany them. Okay, so that's also wrong. B is the correct answer. Patient should be given. So this is definitely it is going into the passive voice. Okay. So who is giving is not mentioned here. Maybe a member of staff, but patient should be given as much information as is available. So it is given here that the patient must be given information so that they have time to digest. Yes. So you should provide patient information. See sheets that explain all the details. They should be provided on booking to give the patient enough time. And then you have other instructions as well, right? If the possible date of the procedure itself should be given to the patient when they attend the clinic. And then again, it is also talking about the selection criteria, basically because this is about three things. It is patient selection, pre-assessment, and preparation. All three things are there. These out detailed questions are different. You're not looking for a summary of the whole paragraph. Okay? You're looking for a specific detail, and you will need to kind of compare all three answer choices with the specific portion of the detail that you are reading. So those of you who might have missed the last session when I discussed purpose questions, you may go to the Teachables reading section and you can look at reading part B3. The test that I'm sharing right now is test 4. Test 3 is purpose questions. And if you will go to the reading strategy session, there will also be a reading part B strategy session where I have discussed the main idea and detailed questions as well. Definitely, these things are going to be discussed again during the virtual class. But if you want to, start practicing it without having to wait for it, then you can also view the videos, and they are as effective as the virtual class for you to learn the concept. So, as soon as you have learned the strategies, you can start practicing from the beginners or intermediate book. It's very, very important that after learning the strategy on the same day, you should be doing more tasks from that particular portion. For example, if you have done reading part B session today in the class, then it's must that you should do at least one test from reading part B. Wherever you are, if you are at the beginner level, then do one test from the beginners. If you are at intermediate level, do one test from the intermediate. Do not focus on time. Make sure that you understand every single word. Make sure that you are able to understand why your answers are right or wrong. Okay, and that is the focus: understanding and learning strategies. Time is not the focus. Once you complete intermediate and you get into advanced, that is probably the right time for you to do the timed practice. Okay, so that's all from my side, from reading part B, test 4, the particular